Tips to reduce the risk of preventable cancer. Reducing the risk of preventable cancer. Cancer is a complex and multifaceted disease, but there are many ways to reduce your risk of developing preventable cancers. By making informed lifestyle choices, dietary changes, and adopting cancer prevention strategies, you can significantly lower your risk of cancer. Lifestyle changes. Don't use tobacco. Tobacco use is linked to various types of cancer, including lung, mouth, throat, and esophageal cancers. Quitting tobacco can significantly reduce your cancer risk. There are many resources available to help you quit, including nicotine replacement, support groups, and counseling. Maintain a healthy weight. Excess body fat increases the risk of several cancers, including breast, colon, and pancreatic cancers. Focus on portion control and nutrient-dense foods, such as fruits, vegetables, whole grains, and lean proteins. Exercise regularly. Aim for at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous activity weekly. Physical activity can lower the risk of colon, breast, and lung cancers. You can also incorporate strength training, flexibility exercises, and high-intensity interval training, HIIT, into your routine. Dietary changes. Eat a plant-based diet. Focus on fruits, vegetables, whole grains, and lean proteins. Aim for 5 or more servings of fruits and vegetables daily. Some examples of plant-based foods include leafy greens like spinach and kale, cruciferous vegetables like broccoli and cauliflower, berries like blueberries and strawberries, legumes like beans and lentils. Limit processed foods. Reduce intake of sugary drinks, high-fat snacks, and processed meats, which may increase the risk of colon and prostate cancers. Opt for whole, unprocessed foods whenever possible. Limit red meat. Opt for lean proteins like poultry, fish, and legumes. Red meat has been linked to an increased risk of certain cancers, so it's best to limit your intake. Cancer prevention strategies. Protect your skin. Use broad-spectrum sunscreen with SPF 30 or higher, wear protective clothing, and avoid tanning beds to prevent skin cancer. You can also wear a hat, seek shade, and avoid spending time in the sun during peak hours. Get vaccinated. Vaccines against HPV and hepatitis B can prevent cancers caused by these viruses. Talk to your doctor about getting vaccinated if you're at risk. Practice safe sex. Limit your number of sexual partners and use condoms to reduce the risk of HPV and HIV. You can also get tested regularly for STIs. Avoid risky behaviors, don't share needles, and avoid exposure to industrial and environmental toxins. If you work with hazardous materials, make sure to follow safety protocols and wear protective gear. Additional tips. Limit alcohol consumption. Alcohol increases the risk of various cancers, including breast, colon, and liver cancers. Limit your intake to 1 drink per day for women and 2 drinks per day for men. You can also try alternative drinks, like sparkling water or tea. Get regular screenings. Schedule regular checkups and screenings to detect cancer early, when treatment is more effective. Some common cancer screenings include mammograms for breast cancer, colonoscopies for colon cancer, Pap tests for cervical cancer. Manage stress. Engage in stress-reducing activities like meditation, yoga, or walking. You can also try deep breathing exercises, journaling, or talking to a therapist. By incorporating these tips into your lifestyle, you can significantly reduce your risk of preventable cancer. Remember to talk to your doctor about your individual risk factors and any concerns you may have. By taking control of your health and making informed choices, you can reduce your risk of cancer and live a healthier, happier life.